से मोती हंस दे फिसल कर खो न जाए ये तारे ज़मीन पर.
Respected members, Cancer NGO, India Cancer Society, Usha ma'am, Smita, thank you so much for giving Zee Business the opportunity to conduct a discussion around this important issue. Cancer treatment are the benefits of scientific progress reaching the most needy. So we'll be touching base upon all those aspects. So very quickly we'll begin the panel discussion. So we'll begin with you. I mean, in a Jankari, cancer is the second largest, highest disease after heart. So there is a myth that cancer means end of life. And I mean, are the survival rates of cancer better now or were they before? And what are the reasons why do you think so? If you can just add value.
First and foremost is basically now we are more into cancer prevention also.
All right.
So there are many cancers which can be totally prevented. For example, in India, 70% of the cancers are totally preventable. For example, those related to tobacco, to various lifestyles, alcohol, all those type of cancers and various infections also, that those can be prevented. And the other thing is, if you increase the awareness, that as it has been doing in the past, recent past, is that by increasing awareness you can diagnose these patients earlier also. So cancer can be curable only for the, if it's diagnosed early,
right,
diagnosed properly and treated appropriately.
Sure. Moving on, Mr. Tchoumi, it is said that medicine prices in India are the lowest in the world. Do you agree with this statement?
Intervention in cancer can be costly. I think what I've witnessed here this afternoon, what I've seen happen in what ICIC and HDCF did, they have demonstrated that if you mobilize the resource through a system who can manage it appropriately, the cost is irrelevant. I think that's critical what we have seen here today. I think the challenge of what we have seen here today is how can we scale it up, right? How can we mobilize? What can mobilize resource, being national, being individual, being corporate-wise, and provide it to a system which in some system is called national security, national health security, in order to make sure that the costs become not the issue, and the issue become maybe detect earlier so that you can increase the chance of cure, educate. Now, coming back to the price, again, and that becomes that equation of the system, and Shailesh can speak to it better than me because he has better experience on that in India than me, and far greater experience. Definitely, if I look at our book, I can confidently say, and is auditable, that we have one of the lowest, if not the lowest price in India. But again, you could challenge, yeah, but how come that is still costly? My view is, if we have more of what we have seen here, costs will go down, access will increase, and the issue will move somewhere else.
Dr. Shailesh, I mean, for a larger responsible MNC like Sanofi, so how do you view the Indian market as? I mean, in terms of pricing of the medicines, the same question goes to you as well.
Global burden of cancer is really going to an epidemic proportion. We all know this. When we started the millennium, and if you look at what is the projection by 2020, we are really talking about an increase by almost 5 times the deaths that we will have because of cancer. Now, this is also happening because on one side, the population is going up to close to about 8 billion population by 2030. The affluence is going up. The lifestyle is changing. So as a result, there are a number of reasons why cancer is going to be one of the most important causes of death. Already 12% of deaths worldwide, 1 in 8 deaths worldwide is happening because of cancer. So there's no doubt in anybody's mind that this is an area of focus. And everybody needs to really understand this is the most emotional part in anybody's life. When you have your loved one really at a stage where you don't know whether this person will survive or not. So given that, the pharmaceutical industry's responsibility is enormous in terms of ensuring that unmet medical needs are met. That would mean a significant investment in research and development to identify targets which are specific to those cancer treatment.
Sure, we're talking about cost effectiveness for a pharma company and how best the cost should work out. But Milind, ये idea कहाँ से आया first of all, and then कितना effort लगा था इसके लिए आपको?
देखिए एक्चुअली जो फंड की शुरुआत हुई वो that was in 2011,
right,
and our business really, the mutual fund business started in 2001. जब हमारी first 10-year anniversary we wanted to celebrate, हम सोच रहे थे कि how can we do it in a slightly different way, and we thought we should do it in something that makes a small contribution, a very small contribution to a philanthropic cause. In the course of that sort of brainstorming, we had a couple of interactions with the Indian Cancer Society, and in couple of the meetings that we attended, we came away with one very clear understanding of what a cause like this needed. It needed money which is very simple, but it needed a sustainable money for a given period of time to develop and structure a program around that fund's availability for the impact of that fund to be maximum.
Right.
वैसे काफ़ी जो NGOs है, बहुत सारी NGOs है जो अच्छा काम करते हैं, but वो hand to mouth होते हैं, जो donors के पास जाते हैं, जितना पैसा मिलता है उस हिसाब से उसका अच्छा यूज़ हो जाता है.
जी बिल्कुल.
But यहाँ पे ये ज़रूरी ये था कि कैंसर की ट्रीटमेंट आमतौर पे it is long, and you need sustainable source for any NGO to be able to create a good program for this. And इसकी देखिए म्यूचुअल फंड यानी एसेट मैनेजमेंट कंपनी की व्हाट इज द टू स्किल्स दैट वी हैव. एक तो स्किल हमारी इन्वेस्टमेंट में है, एंड द सेकंड इज दैट वी हैव द डिस्ट्रीब्यूशन, वी हैव द एबिलिटी टू रीच इन्वेस्टर्स हु हैव मनी. तो आई ऑलवेज थिंक कि वी आर वेरी ब्लेस्ड कि हमारे कस्टमर्स आर पीपल हु हैव मनी टू इन्वेस्ट, और आमतौर पे वी आर टॉकिंग टू देम और डायलॉगिंग विद देम कि उस इन्वेस्टमेंट्स की क्या रिटर्न होगी, क्या रिस्क होगी. बट हियर द कॉन्वर्सेशन इज वेरी डिफरेंट. It is about telling them how that money is not going to enhance their return, but go for a good cause. और इस तरह से वो the start came from that.
Usha ma'am, coming to you, like Indian Cancer Society has been running the Cancer Care Fund project for a long time, and this is a noble cause, and you have been doing really well. I mean, I've been seeing the response of the audience. Can you just take us through this?
Concept is that it allows a certain amount of planning possible at the level of the NGO. And I think that's the point Milind was making. So if you have a 3-year horizon, and because it's a mutual fund, there's always the opportunity to roll over. So when people put the money in the fund, the first one.
Exactly.
So when you go for the second fund, and that is what we did in 2014. So the people who'd already put money, you could get more from them. So they don't really take it out. And then you get new investors in. So in a way, it gets rolled over, particularly if you're doing well. So you have to match the expectations of the investors.
Great.
And I think that's where probably we could, achieve the success in the second fund. I mean, I'm not minimizing the marketing, tremendous initiative and talent of the HDFC team. But I think the thing was that we could actually say, listen, this is what we are doing. So it was possible to increase, and HDFC mutual fund, I mean, Milind has himself, sort of so convinced. So when we started scaling up, and this scaling up, we really started after 2014, when we could go from something like what we were getting is about 4 crores per annum. We moved to 9, and the HDFC mutual fund itself gave 5, so we moved to 14. And they've now topped it up just because you don't want to see a curable cancer going untreated.
Right.
So that lies at the bottom of everything. And so when you do that, the kind of commitment that we've seen from the HDFC mutual fund is that kind of a commitment. So this is what I think has demonstrated is the scalability and the sustainability of an effort to reach cancer cure to the poor. And without running from pillar to post.
Right.
Whether a funding organization like us has to run from pillar to post, or a needy patient has to run from pillar to post. I'd just like to make one more point, and that is about the cost. So we've been talking about cost of treatment. Now when you do see that patient, say a patient who has to come from Srinagar, if they had to come to Bombay or Vellore for treatment, look at the kind of costs they would incur just in the journey, just in the living, and then the complete, if you're able to provide them good quality treatment in the place where they are living, then we will be increasing the access so much more and thereby reducing their total cost. Otherwise, today they mortgage everything, they sell their jewelry. It's just, when you know that there is cancer, it's not just the treatment cost, it's a whole lot of cost. And that's what people really do. So I think we have to see that we spread this access to the remote parts of the country. It's quite right what you said about infrastructure. You do need a good infrastructure there, because we can't just empanel a hospital without really being completely confident that it's going to provide all the services that are needed.
Indian Cancer Society has actually shown the way forward. But I think we as an industry are willing to work very closely, that it is a responsibility to ensure that no patient in our country goes back without treatment just because he or she does not have the means to pay for it.
मी ग्लो फेयरनेस क्रीम में है मल्टीविटामिन्स और एडवांस्ड ब्राइटनिंग इंग्रेडिएंट्स जो त्वचा में जाकर उसे नरिश करें, और इसका SPF दे धूप से सुरक्षा, जिससे आपको मिले ब्राइट फेयर स्किन।
मी ग्लो फेयर है।
Life begins in one beautiful home, और फिर you leave it. You grow and you grow, और फिर you leave home again. You work, you sleep, you work. और इस बीच प्यार हो जाता है, और फिर you leave home. You make another home your own. और एक दिन you become the home.
बदले आप तो बदला आपका घर। बदला क्विकर ने घर खरीदने, बेचने और रेंट करने का तरीका। क्विकर होम्स, आसान है बदलना।
ये सीजन है दुनिया देखने का। ये डिस्काउंट ऑन select hotels across 180 destinations with our Christmas and New Year sale. Log on to hotels.com.
डॉक्टर अचाम इज्जत कमाने के लिए इतना कुछ किया और इत्तू से गिले का मदीना। घर पे लगाओ नेरोलैक्स सुरक्षा, सिर्फ इत्तू से पैसों में बारिश और धूप से सुरक्षा, और आपकी इज्जत।
We are talking about cost and various difficulties the patient faces when he goes through this cancer. But how long does it take for an innovative cancer product to become available in India after it's an invention outside India?
There are two aspects to this. We definitely need more newer drugs for treating cancer, because we know there are so many cancers which are still not curable. So we need new drugs, new drug discoveries for that. But at the same time, actually the cost of, whenever you have a new product, the cost of the treatment goes up, and basically overall it increases the cost of treatment. In the coming age, actually in the present age, it's very difficult not to get any new drug which is, for example, in USA, if the FDA approves a new drug, within no time you can get the same drug in India, though it's not been marketed on patient-to-patient basis. If you can afford the drug, it can be given in the same time. So there's no difficulty in getting the drug, and most of the companies now within a short time even market a drug in India. So getting a new drug is not a problem, but the affordability definitely becomes a problem. Countries like India and other developing countries, I think what we need to look at is not drug discoveries but drug repositioning. Because there are so many drugs out there which are now found to be useful in cancer, and these are time-tested drugs like celecoxib, propranolol. These are very, very low-cost drugs which we are now using for treatment of cancer. So this type of research, I think, is what we need to do. So let the drug be discovered in the West. It will come to India in a short time, and the drug prices will go down. Like imatinib was a drug for a type of leukemia called chronic myeloid leukemia. When it came years back, it cost more than 1 lakh rupees a month for treatment. Now the same drug in India costs less than 2,000 rupees a month. So the cost will come down. Cancer kills in two ways. I always say, cancer itself kills many of our patients, but the treatment, the cost of treatment that is there also kills not only the patient, but the families. And we have seen a lot of the families which have been ruined because of the treatment of cancer. So I think we have to find a balance and make sure that we try to cure more patients. at the same time don't ruin the family, then not only the cost is coming down because of such, this thing, but very importantly now because of the CSR activities, because of various NGOs like the Indian Cancer Society, we saw this, how beautifully they have helped us treat the patients with curable cancer. So because of all this, now more and more patients we are able to cure them with because of the available funds.
Moving on, if you compare the cancer medicine prices in India versus the Europe, as well as you've also been a part of the African region. You have done a lot of good work there. So if you can just compare.
What we try, at least as in our organization, to do, and which we have done in Africa and we are trying to do now in India, is to ensure that a country does not pay more than it should be paid. If you have a system in place, we could double, triple this number of patients.
All right.
Price goes down by himself. Economically based on. That's the type of thing we have tried to do in different disease areas, and we are prepared to do in cancer as well.
Sure, like to add on that.
If healthcare is a priority, you need to really beef up significant amount of healthcare resources. And now it's not just for funding the medicines. What is needed, as Usha was saying, we need hospitals. We don't need people to travel thousands of miles to come and get treatment for cancer. Can we not have capacity built up in every state? How can we ensure that a national cancer policy is being developed? How about a state-wise cancer policy, where we ensure that all stakeholders are brought together to really understand the extent of different cancers in every state, and make sure that we have a comprehensive program bringing everybody together to help this issue. But then everybody will have to chip in, because it's not one individual industry or one individual entity who can really solve this problem. And that's why you see that even if you make this medicine free of cost to everybody, still we will not be able to bring down the incidence of cancer or the treatment outcomes better. It's simply because there are a number of other things that need to go together. Palliative care, we need to ensure that the people are diagnosed properly, the proper treatment that needs to be given under medical supervision. All these aspects would need a significant amount of investment. And that's where I think today there is an opportunity for us to do it. Indian Cancer Society has actually shown the way forward. But I think we as an industry are willing to work very closely. I mean, the entire industry is willing to join hands, the Indian industry and the multinational companies, knowing fully that it is a responsibility to ensure that no patient in our country goes back without treatment just because he or she does not have the means to pay for it. But this would require a coalition, and I think it's doable.
As Dr. Ayyangar, Usha ma'am, the next question is to you. As Dr. Ayyangar has said that there needs to be a collaborative effort for this. I mean, what do you see are the issues and difficulties on the ground that people face, after they are diagnosed with this cancer?
Ground level is that the first issue is that it depends again on where you are.
Right.
And if you are diagnosed, and then you obviously want to know where do you go now, which is the nearest place you can go to get proper advice. And very often you're going to get advice from a whole lot of people. And the referral will probably be to the nearest government hospital. And there you probably have to go through a whole lot of tests to see whether it is confirmed. And then the decision comes as to whether that particular place is going to give you, because you as a person don't really know anything.
We are talking about affordability, and very direct question to you. Moving on, अगर हम efforts की अगर हम बात करें और cancer specialized hospitals की अगर हम बात करें, beyond metros कितना effort लिया जा रहा है ये hospital segment को रूरल एरियाज में और विलेज एरिया में लेके जाना, जहाँ पे उषा मैम वो जस्ट मेंशनिंग अबाउट द ज्योग्राफिकल एरिया. आई मीन सम अदर रीजन से वेस्ट में आते हैं ट्रीटमेंट के लिए, बट वो कितना हॉस्पिटल अवेलेबल है जहाँ पे ट्रीटमेंट हो सके, और एफर्ट्स लिए जा रहे हैं उसको वहाँ तक पहुँचाने के लिए.
Yeah, there is a parity of cancer care in India, not only in India but all the developing countries, and it is that most of the cancers which are diagnosed early are taken care of by people or doctors locally without using the principles of cancer care. So in cancer we require to use certain principles like how to operate, what chemo to give, whether to give radiation. So without applying this, the early cancers are taken care of locally, and then they are made incurable. And on the other hand, the patients who basically cannot come to the cities are there, and and they have advanced disease, because by the time they can arrange to come to the the metros, the disease advances by the time they arrange funds, take care of the other children, etc. When we started, there was only chemotherapy and surgery. And we saw that if you don't give the radiation therapy locally, patients won't come to Tata, and then the whole cycle of treatment doesn't get completed and patients don't benefit. So we will now give all the treatment there locally, and we have developed this.
हम लोग very quickly would like to know from you, हम बात कर रहे हैं affordability और यहाँ से लेके अच्छे hospitals other regions में जहाँ पे वो hospitals नहीं है वहाँ पे available होने के, but CSR activity का कितना बड़ा role और कितना importance relevance होना चाहिए this cause को लेके?
I think the CSR is something that's now just come in 2013 Companies Act.
Right.
And there are estimates that the total amount that could be possible or required to be actually used by companies, the corporate sector, is about somewhere between around 18,000 crores. And I think broadly speaking, the CSR activities can be in two parts, which is either in education or in healthcare. And while some of it is well spent in education, under healthcare, there are various causes. I think the challenge the corporate sector will face, and I think to my mind is already facing, is the efficacy of the structure by which this money can be even utilized. Most corporates are not very sure how they are going to utilize this 2% of their profits. I'm not trying to say all, but many companies would probably find it difficult to find the best way of utilizing this money. And I think it's over a period of time, there will be a need of a structure and framework to be created, which is either like what the Indian Cancer Society has done or similar other structures, by which a method of dispensing financial aid for healthcare is streamlined. And the objective of doing that, it gives the confidence to the companies or the donors that the money is used for what it is going, it is used in an efficient manner, and it is going for the purpose for which it is being given.
Right.
And I think building that confidence in the giver is a very key foundation to this process starting of giving itself. The data on giving in India, on corporate giving in India, unfortunately is not very flattering. From total amount of wealth that people in India are willing to donate for social causes generally is very low, and is significantly lower than many other even developing countries. But I'm sure with time this will change.
Usha ma'am, very quickly from you, that Milind was mentioning about 18,000 crores का CSR activity is the total size of Indian corporates. But हम उसको use करने की अगर हम बात कर रहे हैं, what role NGO plays if they are using this CSR, the value which is coming into the.
There is really no reason why NGOs cannot do a better job of getting the money. Very often, that is what is sometimes lacking. So we need to really, build up that credibility of the purpose and the scheme and the project to the companies and the institutions who have a large CSR budget. And I think that is where we will find more money coming into the kind of efforts we are moving towards.
Sure. Before we wrap up, a common question to all the panelists. Very quickly, it will be a common question, and the answer will be in yes or no or in one line. Is cancer treatment really reaching the poorest in the country? What do you think?
Support that we can get through the NGOs, through the government, various schemes, as well as the infrastructure and the communication that is available, it is reaching the poorest of the poor.
Should be your closing comments on that?
With what we saw today, with video we saw, the answer is clear, yes.
All right.
Now, the next question is that enough? And what is the mechanism to take it up?
Lot needs to be done.
All right.
I think yes, answer is yes, but need to improve.
Usha ma'am.
Same, yes, and I would say 75% perhaps needs to be done.
All right. So with this, we'll wrap up the session. Thank you so much, Dr. Banavali. And Shurmi, thank you so much. Dr. Shailesh, Milind, and Usha ma'am, thank you so much for being a part of this discussion. Thank you so much, everyone.